All right, so if ice isn't all that good for inflammation and it doesn't really impact you as a skater, are there some things it's actually good for?
Yeah, ice does have its use. I would say the best thing ice can do is it can be a really good painkiller. So it can be beneficial at sort of immediately numbing pain after, let's say, an ankle sprain. What's good about it is it's simple, it's cheap, it's safe, and a lot of people don't like taking pain medications. They don't want to take ibuprofen and some of these other pain medications. So ice can be a nice alternative to try instead of those things.
This is like generalizing, but do you know why some people are against things like ibuprofen?
Yeah, there's a couple of studies that kind of caught wind in the mainstream media about sort of effects that ibuprofen and some of these other anti-inflammatories have, like on the stomach and stuff like that. And I think it shied a lot of people away from using them as much. And the side effects, or I think some of those studies were a little bit overblown as far as how the media interpreted them. But that's kind of why, at least within the last 10, 15 years, people seem to not want to use them as much.
I notice that a lot, I feel like.
Yeah. Yeah, my patients, it's kind of funny. Some of my patients will be like, Kyle, if I take one ibuprofen, you think that's too much? I'm like, no. You're going to be fine.
Yeah.
You're going to be fine, John, who's a healthy 27-year-old, active person.
Yeah.
You'll be fine. But yeah, I noticed that too. But we probably don't need to eat them like candy like you do, but they're...
Yeah. Or my mom.
Yeah, or your mom, but they're not as gnarly as some people think they are. Yeah, so ice can be a pretty good painkiller, and it can also decrease the sensation of soreness after a heavy session, kind of like what you use it for.
Yeah, because I feel like that's my goal with an ice bath is like I don't really do it if I've strained a leg or a muscle or something like that. It's just I want my legs to be a little less sore. That's like all I hope for.
Yeah. Yeah, so it'll help decrease that feeling of soreness. It's not going to necessarily help you heal faster from that gnarly session, but you'll feel a little bit better.
Yeah.
And, there's nothing wrong with soreness. Some people treat soreness like kind of like inflammation, like it's this bad thing that we need to try to minimize at all costs. Mm-hmm. Soreness is completely normal, but sometimes it can be a little annoying when it's really bad. And ice can be
like when it hinders you or stops you from skating, kind of.
Yeah, or the intensity is enough where it's hard to sleep, stuff like that. When the sensation of soreness is severe, ice can be a good and cheap method to sort of numb that soreness and decrease the sensation of it. So if you have a swollen and painful ankle after a gnarly ankle sprain, throw some ice on it. It's not going to harm anything, and it's going to make it feel better.
That's good for people to hear that, I think.
Yeah.
That's like
Yeah. So it's just a matter of rethinking what it's actually doing. It's not going to turn that balloon of an ankle into nothing, but it is going to help decrease the pain you have after a freshly sprained ankle. And then on the other end of the spectrum, if you kind of like what you use it for, if you just finished skating a 15 stair for 4 hours and you're really, really sore and you need some quick relief, just jump in an ice bath and you're going to feel better. So those are kind of where situations where ice can be beneficial.
Well, I'm stoked to hear what you're saying about it being, maybe not that beneficial straight after an ankle sprain, because I feel like there's been situations where I've been on a skate trip and, I've done something like a rolled ankle and I haven't been able to get ice, and I've worried that was going to like fuck up my healing process because I didn't immediately get ice on it.
Oh, interesting.
So it's nice to hear that, because a lot of times you just can't get to ice,
Yeah,
it's
for
just
sure.
sort of like, is this like going to prolong my recovery?
Yeah.
But,
yeah, no, I think, seriously, dude, I think how we think of ice it's just been ingrained in our minds, like we really must have it right after an injury. And we just kind of need to put that into perspective a little bit. So yeah, I mean, if you have an ice pack, put it on that sprained ankle and it's going to make it feel better. But if it takes a few hours for that to happen, or an afternoon for that to happen, you're going to be okay. And another thing to note, some research has shown that there are some pretty strong psychological effects of icing that ice has. And it kind of makes sense. If you think about it, for many athletes, ice is a staple part of their recovery ritual, and they have a strong belief that it helps with recovery. And, the ritual, the strong belief in what it does, the intense experience of something like an ice bath, the expectation that it's doing something really good, like all those things are strong psychological factors that basically can add the perception of recovery. And it's basically an additional placebo effect that ice treatment can have.
See, I'm coming around to placebo effects, It's
Yeah.
like positivity. Let's bring it on.
Yeah. As long as it's, in my mind, as long as it's not like a financially burdensome thing that you have to do to get the placebo, the mind is a powerful thing, If you think something works, it's going to affect how, it affects you.
Yeah. So when it comes to your patients, how often do you use ice or recommend it?
I actually recommend it frequently. So if they have a fresh injury, like if they flare up their back, or if they sprain their ankle, I definitely recommend that they try ice to see if it helps. But I have a frank conversation with them about what ice is actually doing. So I try to make sure that they know what they're doing when they're icing their injuries. And I basically say, hey, you're in a lot of pain right now. Ice will help numb the pain. It's not going to do much else than that, but you can use it as something that you can do to help kind of decrease the pain that you're going through. So I use it quite a bit because, like I said, it's cheap, simple.
Yep.
It's really easy to set up at home. So it's something you can definitely try for a lot of these painful injuries that I see in the clinic. And I still use it myself.
Really?
Yeah.
When was the last time you used it?
A month ago. I slept wrong, and I kind of irritated I basically hurt my neck. Old man injury.
Good old fashioned old man.
Yeah.
Waking up injury.
It's a little embarrassing to admit. But yeah, my neck was really painful for a few days, and every night when I got home from work, I'd sit on an ice pack for 20, 30 minutes, and it helped. It helped numb the pain for a couple hours. So I still use it myself. And also, I think like I'm still, even though I know what I know now about what ice is actually doing, it's still ingrained in my brain that when you're injured, you ice it right away. It's just kind of a habit.
Yeah.
Yeah, so I still use it myself.
And then you said you ice for 20, 30 minutes. That's another thing. When it is something you recommend, is it something you don't want to do past a certain amount of time? Or is it, again, sort of just like, well, whatever, it's not doing that much anyway, so it doesn't really matter?
Well, typically I recommend 15, 20 minutes or so. You don't want to ice too long. You don't want to irritate the skin,
Okay. Is that the main reason? I've always sort of wondered about that.
That's the main reason, yeah.
Okay.
So if you are on an ice pack for 2 hours, there's a high likelihood that your skin is going to get irritated. So I dose it based on that.
Cool. So we've covered a lot. What are the main points everyone should take away from this little bonus episode that we have on icing?
Yeah. So number one, inflammation is not a bad thing. It's the body's normal way of healing itself. We probably need to worry a little bit less about inflammation. And we probably need to stop obsessing about, quote unquote, decreasing inflammation with ice and other various treatments. So I think we kind of need to reframe how we think about inflammation. That's number one. Number two, ice does decrease inflammation, but not that much. Number three, ice will not harm the body's overall ability to go through the inflammation process and heal itself. Therefore, ice is a safe treatment to use. And then next, ice can be a very effective treatment for numbing pain and decreasing soreness. So that's when it's the most beneficial. And last but not least, ice is safe, simple, and cheap. So if you feel like it helps, go for it, use it. And that's
cool.
That's pretty much it. Anything I'm missing?
No, that was pretty illuminating, dude. I like it.
Yeah, so hopefully people will learn a thing or two about ice and how it helps and what it actually does.
My name is Dr. Kyle Brown. I'm a physical therapist and longtime skater based in Los Angeles. My vision has always been to, number one, have high quality, evidence-based physical therapy content geared towards skaters. I wanted to make sure that it wasn't just exercise videos, but also informational podcasts as well. Number two, I also wanted the content set up in a way that was organized and easy to navigate. So if a skater comes to our platform for the first time with a random ankle injury, let's say, they can easily sift through all of our content and find exactly what he or she needs. That's why I'm so excited about our new website. All of the content on our new website is organized in a way where you can easily find the exact thing that you're looking for. So for all those skaters who are in need of solutions to your skate-related injuries, but are unable to come see me in person in the clinic, this website is for you.